Hi guys, I'm Aisha and I'm going to talk to you guys about the mediastinum today. So let's look at what is the mediastinum? A mediastinum is a space in the thoracic cavity that is in between our pleural sacs. So let's look at its boundaries and its location. So let's say this is the thoracic cavity, these are our lungs. So our mediastinum is here. Laterally it has the pleural cavities. Superiorly it is bound by the superior thoracic aperture. What is the superior thoracic aperture made of? It has the manubrium, the first ribs, and its costal cartilages, as well as T1. So this makes the thoracic vertebral column, first thoracic vertebra. This is what makes the superior thoracic, superior thoracic aperture, and it is superiorly bound by this. Inferiorly, it is bound by the diaphragm, and posteriorly, behind this, it is bound by the thoracic vertebrae. And yeah, that's about it. That's its boundaries. And sorry, anteriorly, we don't say anteriorly. Anteriorly, there are the ribs and the sternum. Ribs and the sternum anteriorly. Now let's look at what the mediastinum has. So the mediastinum is divided into two spaces, superior mediastinum and inferior mediastinum, by an imaginary line that goes from anteriorly to posteriorly from the sternal angle to around T4, T5. It's an imaginary line called the line of sternal angle. It divides it into a superior part and an inferior part. The inferior mediastinum has three divisions of its own: anterior, middle, that's where our heart and its vessels, blah blah, is this, and then posterior inferior mediastinum. And the superior mediastinum, to know what the contents of that are, I'm going to divide it into 5 groups, and I'm going to go through the groups starting anteriorly to posteriorly. I'm going to go anterior to posterior direction. So in the first one we have is, 1 2 3 4. So the first one we have is the thymus. Okay, I'm just going to write them down first. Thymus, then the venous supply, nerves, arterial supply, and some organs. So number 1, thymus. So anteriorly we have the thymus, and we also have the origins of a few muscles such as sternohyoid and sternothyroid, and also the inferior aspect of the muscle longus coli. That is for the first part. Now coming to the venous supply, part 2, we have the superior vena cava, we have the brachiocephalic veins. I'm going to get a picture out of this. Okay, so this, as we can see in this picture, this is the superior part. We have superior vena cava, brachiocephalic veins, and we also have the left superior and supreme intercostal veins, which is not shown here, but it is important to remember. After that, we come to the nerves, which are fairly simple as well. We have the vagus nerve, which is very important, recurrent laryngeal nerve, which is an offshoot of the vagus nerve. We have our phrenic nerve, and we have also the sympathetic trunk, as you can see here. And that sums up the nerves. Now let's move on to the arterial supply. The arterial supply is really simple. You have the ascending aorta, the aortic arch, and the major branches from the aortic arch. You also have the pulmonary trunk and the pulmonary vessels. So that is the arterial part. Apart from last part we have to do for the superior mediastinum are the organs. If we look at this picture for a second, just for some perspective, we can see this is a picture. We're looking through the superior thoracic aperture. We're looking down. And as we can see, this is posteriorly, this is the vertebral column, and here we can see we have the esophagus most posteriorly, then we have the trachea, and then we have the vessels and thymus in front. So just for some reference, so organs, what are the organs we have? We have trachea, we have bronchi, we have behind it esophagus, and we have the thoracic duct, which is very important to remember. Now, before I move on to the inferior mediastinum, let me just tell you about the lymph nodes. The whole area of the mediastinum has a lot of lymph nodes, and the main important ones that we have to know are the anterior mediastinal lymph nodes, paratracheal lymph nodes, pretracheal lymph nodes, paratracheal, pretracheal, and tracheobronchial lymph nodes. These are the most important ones. Now moving on to the inferior mediastinum. This anterior part is, as we can see, it is not that big a space. It has the sternopericardial ligaments, it has fat, it has some lymph nodes, it has some vessels, and including the internal thoracic vessels. In the middle part, we have obviously the heart, the pericardium, the vessels of the heart, phrenic nerves, and we have tracheobronchial lymph nodes. Lastly, the posterior inferior mediastinum. Here there are four main things: the vessels, some nerves, the esophagus, and the thoracic duct. So the vessels, we have the descending aorta and its thoracic branches. We have the inferior vena cava, and we have the azygous system of veins. So as we can see here, inferior vena cava, descending aorta and its branches, azygous system of veins. Coming to nerves, we have the sympathetic trunk, and we have the splanchnic nerves, as well as the vagus nerve. And apart from this, as I said, the last two things to remember from the posterior part are the esophagus and the thoracic duct. So that concludes this lecture on the contents of the mediastinum. Thank you.